Question 1. Governance review demonstrates that a traditional Chinese medicine, TCM, practitioner, licensed and practicing within the specified regulatory framework, is treating a patient experiencing menopausal symptoms. The patient has recently undergone conventional medical assessments, including a bone density scan that indicates early-stage osteoporosis. The practitioner is considering their approach to managing the patient's menopausal symptoms and the implications of the osteoporosis diagnosis. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for TCM practitioners in this jurisdiction? Option A. Disregard the bone density scan results as they are outside the scope of TCM diagnosis and focus solely on TCM methods for managing menopausal symptoms, assuming they will indirectly address bone health. Option B. Advise the patient to cease all conventional medical treatments for osteoporosis and rely exclusively on TCM therapies for both menopausal symptoms and bone health. Option C. Prescribe TCM herbs and acupuncture solely based on the osteoporosis diagnosis from the bone density scan, without considering the patient's menopausal symptoms or consulting with a Western medical physician. Option D. Integrate the findings of the bone density scan into the TCM diagnosis and treatment plan, ensuring TCM interventions complement, rather than contradict, conventional medical recommendations for osteoporosis management, and referring to a Western medical physician for ongoing osteoporosis care if deemed necessary. Correct answer is D. Integrate the findings of the bone density scan into the TCM diagnosis and treatment plan, ensuring TCM interventions complement, rather than contradict, conventional medical recommendations for osteoporosis management, and referring to a Western medical physician for ongoing osteoporosis care if deemed necessary. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of managing menopausal symptoms within the scope of traditional Chinese medicine, TCM, practice, particularly when considering the integration of Western medical diagnostics. The challenge lies in balancing established TCM diagnostic and treatment principles with the need to acknowledge and appropriately respond to findings from conventional medical assessments, ensuring patient safety and comprehensive care. Practitioner must navigate potential conflicts or misunderstandings arising from differing diagnostic paradigms and treatment philosophies. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and holistic care by integrating TCM diagnostic methods with an understanding of Western medical information. This approach aligns with the ethical obligation to provide competent care, which includes recognizing the limitations of one's own practice and collaborating with other healthcare professionals when necessary. Specifically, it upholds the principle of do no harm by ensuring that TCM interventions do not contradict or interfere with necessary conventional medical management for conditions like osteoporosis, which may be diagnosed through Western methods. It also reflects a commitment to evidence-informed practice, acknowledging that both TCM and Western medicine offer valuable insights into patient health. Incorrect approaches analysis. One incorrect approach fails by dismissing or ignoring Western medical diagnostic findings related to menopause, such as bone density scans indicating osteoporosis. This represents a significant regulatory and ethical failure. It violates the duty of care by potentially overlooking serious underlying conditions that require conventional medical management, thereby jeopardizing patient safety. Ethically, it demonstrates a lack of professional responsibility and a failure to provide comprehensive care. Another incorrect approach is to solely rely on Western medical diagnoses and prescribe treatments based solely on those findings, neglecting TCM's unique diagnostic framework and therapeutic modalities for menopausal symptoms. This is an ethical failure, as it fails to utilize the full scope of TCM practice for which the practitioner is licensed and trained. It also represents a missed opportunity to offer patients the benefits of integrated care, potentially leading to suboptimal outcomes. A third incorrect approach involves attempting to treat conditions diagnosed by Western medicine that fall outside the scope of TCM practice, without appropriate referral or consultation. This is a critical regulatory and ethical failure, as it constitutes practicing beyond one's competence and licensure. It poses a direct risk to patient safety and undermines the integrity of the TCM profession. Professional reasoning. Professionals should adopt a decision-making process that begins with a thorough assessment of the patient's presenting complaints and medical history, encompassing both TCM and Western medical information. When Western medical diagnostics reveal conditions that require conventional treatment or have implications for TCM treatment, the practitioner must integrate this information into their TCM diagnosis and treatment plan. This may involve consulting with Western medical practitioners, referring patients for further investigation or treatment when necessary, and clearly communicating the scope of TCM care to the patient. The guiding principle is always patient well-being, achieved through competent, ethical, and collaborative practice. Question 2. Implementation of a comprehensive diagnostic assessment for a patient presenting with persistent fatigue and a pale complexion, considering the potential interplay between Qi and blood imbalances according to traditional Chinese medicine principles. Option A. Recommend a course of iron supplements and advise the patient to consume more red meat, assuming a Western medical diagnosis of anemia. Option B. Conduct a thorough pulse and tongue diagnosis. Inquire about specific qualities of the fatigue, e.g., sudden onset vs. gradual, worse with exertion, and assess for other signs indicative of Qi or blood deficiency. Option C. Prescribe a broad-spectrum Qi tonic based on the fatigue symptom and recommend increased rest. Option D. Suggest a general blood-purifying herbal formula without further diagnostic inquiry. The correct answer is C. Prescribe a broad-spectrum Qi tonic based on the fatigue symptom and recommend increased rest. Explanation. This scenario presents a common challenge in traditional Chinese medicine, TCM, practice, differentiating between Qi deficiency and blood deficiency, as both can manifest with symptoms like fatigue and paleness. The professional challenge lies in accurately diagnosing the root cause to ensure effective treatment, adhering to the principles of TCM theory and the ethical obligations of a practitioner. Misdiagnosis can lead to ineffective treatment, patient dissatisfaction, and potential harm. The correct approach involves a thorough differential diagnosis that goes beyond superficial symptoms. It requires the practitioner to meticulously assess the patient's pulse, tongue, and overall constitution, considering the specific qualities of the symptoms described. For instance, fatigue and Qi deficiency is often accompanied by a weak pulse and a pale tongue with teeth marks, while fatigue and blood deficiency might present with a thready pulse and a pale, dry tongue. This detailed assessment, grounded in established TCM diagnostic methods, represents best professional practice. It aligns with the ethical duty to provide competent and individualized care, ensuring that treatment targets the specific imbalance identified. Regulatory frameworks for TCM practitioners emphasize the importance of accurate diagnosis based on established diagnostic methods. An incorrect approach would be to immediately prescribe a treatment based solely on the symptom of fatigue or paleness, without a comprehensive diagnostic evaluation. This superficial approach fails to identify the underlying TCM pattern. For example, prescribing tonifying Qi herbs for a patient whose primary issue is blood deficiency would be ineffective and could potentially exacerbate the blood deficiency by further depleting the blood. This constitutes a regulatory and ethical failure as it deviates from the standard of care expected of a TCM practitioner, potentially leading to patient harm and a breach of professional responsibility. Another incorrect approach would be to rely on Western medical diagnoses alone to guide TCM treatment, ignoring the unique diagnostic framework of TCM. While Western medicine can provide valuable information, it does not replace the need for TCM pattern differentiation. Failure to integrate TCM diagnostic principles into treatment planning is a significant professional and ethical lapse. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive patient information, including detailed symptom presentation, medical history, and lifestyle factors. 2. Apply TCM diagnostic methods rigorously. Observe the tongue, palpate the pulse, and inquire about specific sensations and characteristics of symptoms. 3. Differentiate between similar TCM patterns based on the nuances of the diagnostic findings. 4. Formulate a treatment plan that directly addresses the identified TCM pattern, considering the interplay of Qi and blood. 5. Continuously monitor the patient's response to treatment and adjust the plan as necessary. Question 3. The risk matrix shows that a new patient presents with a chief complaint of fatigue and a pale complexion. The practitioner has a limited amount of time for the initial consultation. considering the foundational principles of traditional Chinese medicine diagnosis and the need for a comprehensive initial assessment, which diagnostic method, when performed first, would provide the most crucial and foundational information to guide the subsequent diagnostic process for this patient. Option A, auscultating the patient's voice and breathing and observing any odors. Option B, inquiring about the patient's lifestyle, diet, and specific symptoms. Option C, inspecting the patient's complexion, tongue, and overall spirit. Option D, palpating the patient's pulse and abdomen. The correct answer is C, inspecting the patient's complexion, tongue, and overall spirit. Explanation: this scenario presents a common challenge in traditional Chinese medicine, TCM practice, where a practitioner must synthesize information from multiple diagnostic methods to arrive at an accurate diagnosis and treatment plan. The professional challenge lies in discerning which diagnostic method, when presented with potentially conflicting or incomplete information, provides the most crucial and foundational data for understanding the patient's underlying pattern of disharmony. Careful judgment is required to prioritize diagnostic efforts and avoid premature conclusions based on isolated findings. The correct approach represents best professional practice because it prioritizes the foundational diagnostic method that provides the most comprehensive and objective initial assessment of the patient's overall state. Inspection, as the first of the four diagnostic methods, offers a holistic overview of the patient's spirit, shen, complexion, tongue, and body form. This broad visual assessment is critical for establishing a baseline understanding of the patient's constitution and the general nature of their illness, guiding subsequent, more specific diagnostic inquiries. Adhering to the established sequence of diagnostic methods, as outlined in TCM foundational texts and regulatory guidelines for practitioner exams, ensures a systematic and thorough evaluation, minimizing the risk of overlooking significant signs or symptoms. This systematic approach aligns with the ethical imperative to provide competent and comprehensive care. An incorrect approach that focuses solely on palpation without a thorough initial inspection would be professionally unacceptable. Palpation, while vital for assessing pulse and abdominal tenderness, relies on the context provided by other diagnostic methods. Without the visual cues from inspection, the practitioner might misinterpret palpation findings or fail to recognize their significance in relation to the patient's overall presentation. This represents a regulatory and ethical failure to conduct a complete diagnostic assessment, potentially leading to an inaccurate diagnosis and inappropriate treatment, thereby failing to meet the standard of care expected of a licensed TCM practitioner. Another incorrect approach that prioritizes inquiry alone over initial inspection and palpation would also be professionally unacceptable. While patient history is invaluable, it is subjective and can be influenced by the patient's perception, memory, or ability to articulate their symptoms. Relying solely on inquiry without objective physical examination, inspection, and palpation risks accepting subjective reports at face value without corroborating evidence, potentially leading to a diagnosis based on incomplete or biased information. This constitutes a failure to employ the full spectrum of diagnostic tools mandated by TCM principles and regulatory frameworks, thus compromising patient safety and the quality of care. The professional decision-making process for similar situations should involve a systematic adherence to the four diagnostic methods in their established order: inspection, auscultation and olfaction, inquiry, and palpation. Each method builds upon the information gathered from the preceding ones. When faced with a complex case, the practitioner should first conduct a thorough inspection to gain a broad understanding. This initial assessment will then inform the direction and focus of the inquiry, auscultation/olfaction, and palpation. The practitioner must continuously integrate findings from all methods, recognizing that no single method is sufficient in isolation. The ultimate goal is to synthesize all gathered information to form a coherent pattern diagnosis that accurately reflects the patient's condition, thereby guiding the selection of appropriate therapeutic interventions. This systematic and integrated approach is fundamental to competent and ethical TCM practice. Question 4. Compliance review shows a traditional Chinese medicine, TCM, practitioner is assessing a new patient who reports feeling overwhelmed and irritable for the past month. The practitioner notes these terms but does not ask further questions about the specific nature, intensity, duration, or impact of these feelings, nor do they observe for associated nonverbal cues. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for TCM practitioners in assessing emotional and psychological states? Option A. Systematically inquire about the specific emotions experienced, their triggers, duration, intensity, and observe for nonverbal indicators, integrating this information with other diagnostic findings to identify TCM patterns. Option B. Minimize the patient's reported emotional distress, attributing it to external stressors and advising them to manage it independently without exploring its TCM pattern manifestation. Option C. Primarily focus on the patient's physical complaints and only briefly acknowledge the reported emotions without further investigation, assuming they are secondary to physical discomfort. Option D. Accept the patient's self-reported dominant emotions at face value and base the treatment solely on these broad descriptions, without seeking further clarification or diagnostic context. The correct answer is A. Systematically inquire about the specific emotions experienced, their triggers, duration, intensity, and observe for nonverbal indicators, integrating this information with other diagnostic findings to identify TCM patterns. Explanation: scenario analysis. This scenario is professionally challenging because assessing emotional and psychological states in traditional Chinese medicine, TCM, requires a nuanced understanding that integrates observable symptoms with the patient's subjective experience, all within the framework of TCM theory. The practitioner must navigate potential cultural sensitivities, the inherent subjectivity of emotional reporting, and the need to maintain professional boundaries while gathering comprehensive diagnostic information. Accurate assessment is crucial for effective treatment planning, as TCM posits a strong connection between emotions and organ systems. Correct approach analysis. The correct approach involves systematically gathering information about the patient's emotional state through a combination of direct questioning about specific emotions, e.g., sadness, anger, anxiety, observing nonverbal cues, and inquiring about the duration, intensity, and triggers of these emotions. This aligns with the principles of TCM diagnosis, which emphasizes the four examinations: Wang, when, Kai observation, listening/smelling, inquiry, palpation. Specifically, the when inquiry examination directly addresses the patient's subjective experiences, including their emotional well-being. This comprehensive approach ensures that the practitioner obtains a holistic picture of the patient's condition, allowing for accurate pattern differentiation and appropriate treatment selection, thereby adhering to professional standards of care and ethical practice in TCM. Incorrect approaches analysis. One incorrect approach involves solely relying on the patient's self-reported dominant emotion without further exploration. This fails to capture the complexity of emotional imbalances in TCM, which often involve multiple interconnected emotions or subtle manifestations. It neglects the diagnostic value of observing nonverbal cues and understanding the context and impact of the emotion, potentially leading to misdiagnosis and ineffective treatment. This approach also risks oversimplifying a complex diagnostic element, which is contrary to the thoroughness expected in TCM practice. Another incorrect approach is to dismiss or minimize the patient's reported emotional distress, attributing it solely to external factors without considering its internal TCM pattern manifestation. This demonstrates a lack of empathy and a failure to recognize the TCM principle that emotions are intrinsically linked to the health of specific organ systems, e.g., anger with the liver, sadness with the lung. Such an approach not only alienates the patient, but also leads to an incomplete diagnosis, failing to address the root cause of the imbalance according to TCM theory. A third incorrect approach is to focus exclusively on physical symptoms and disregard any mention of emotional or psychological distress. This directly contradicts the holistic philosophy of TCM, which views the mind and body as interconnected. Emotions are considered significant pathogenic factors and indicators of organ system disharmony. Ignoring emotional input would result in a superficial diagnosis and a failure to identify crucial diagnostic clues, leading to suboptimal patient outcomes and a deviation from established TCM diagnostic methodologies. Professional reasoning. Professionals should adopt a systematic and empathetic approach to emotional assessment. This involves active listening, open-ended questioning, and careful observation of both verbal and nonverbal cues. When a patient presents with emotional concerns, The practitioner should inquire about the nature of the emotion, its duration, intensity, triggers, and impact on daily life. This information should then be integrated with other diagnostic findings, observation, pulse, tongue, to form a comprehensive TCM pattern diagnosis. If a patient expresses distress, it should be acknowledged and explored, not dismissed. The practitioner must remember that emotional well-being is a critical component of overall health in TCM and a vital diagnostic indicator. Question 5. The evaluation methodology shows that a practitioner is presented with a patient complaining of fatigue and poor appetite. The practitioner has access to a widely recognized and effective standardized treatment protocol for general fatigue. Which of the following approaches best reflects the principles of individualized treatment planning in traditional Chinese medicine and adheres to regulatory expectations for practitioners? Option A. Conducting a thorough diagnostic assessment, including pulse and tongue examination, detailed questioning about the patient's lifestyle, emotional state, and other symptoms, to differentiate the specific pattern of disharmony before formulating a treatment plan. Option B. Immediately applying the standardized treatment protocol for general fatigue, assuming the patient's symptoms align with the most common presentation of this condition. Option C. Prescribing the most frequently used herbal formula for fatigue, as it is known to be effective for a majority of patients experiencing similar symptoms. Option D. Focusing solely on the presented symptoms of fatigue and poor appetite, and recommending general dietary advice without further diagnostic inquiry. The correct answer is A. Conducting a thorough diagnostic assessment, including pulse and tongue examination, detailed questioning about the patient's lifestyle, emotional state, and other symptoms, to differentiate the specific pattern of disharmony before formulating a treatment plan. Explanation. The evaluation methodology shows that a practitioner is presented with a patient exhibiting symptoms consistent with a common ailment, such as digestive upset. Professional challenge lies in recognizing that, while the outward presentation may be similar to other patients, the underlying etiology, and therefore the most effective treatment strategy, can vary significantly based on individual factors. This requires a deep understanding of TCM principles, particularly the concept of Bian Zheng Lun Jai, pattern differentiation and treatment, which mandates tailoring interventions to the unique presentation of each patient. The correct approach represents best professional practice because it adheres to the core tenets of traditional Chinese medicine and the ethical obligations of a practitioner. By conducting a thorough individual assessment, including pulse and tongue diagnosis, detailed questioning about lifestyle, emotional state, and medical history, the practitioner can accurately differentiate the specific pattern of disharmony. This allows for the creation of a truly individualized treatment plan, which is not only more effective in addressing the root cause of the patient's symptoms, but also minimizes the risk of adverse effects from inappropriate treatment. This aligns with the regulatory framework's emphasis on competent and safe practice, which inherently requires personalized care. An incorrect approach that relies solely on a standardized protocol for common ailments is professionally unacceptable. This fails to acknowledge the complexity and individuality inherent in TCM diagnosis and treatment. Such an approach risks misdiagnosis and ineffective treatment, potentially exacerbating the patient's condition or leading to the development of new imbalances. Ethically, it breaches the duty of care to provide appropriate and effective treatment. From a regulatory standpoint, it demonstrates a lack of adherence to the principles of TCM practice as mandated by the governing bodies, which expect practitioners to apply their diagnostic skills to each unique case. Another incorrect approach, such as prioritizing the use of the most commonly prescribed herbal formula without further differentiation, also falls short. While common formulas exist for common conditions, their efficacy is contingent upon the correct pattern identification. Applying a popular formula to an incorrect pattern is akin to treating a symptom without understanding its origin, a fundamental error in TCM. This approach neglects the crucial step of individual assessment and pattern differentiation, leading to potential harm and a failure to meet professional standards. The professional decision-making process for similar situations should always begin with a comprehensive patient assessment. This involves active listening, detailed questioning, and the application of diagnostic techniques specific to TCM. The practitioner must then synthesize this information to arrive at an accurate pattern differentiation. Only after this rigorous diagnostic process can an individualized treatment plan, encompassing acupuncture, herbal medicine. Dietary recommendations and lifestyle advice be formulated. This systematic approach ensures that treatment is targeted, effective, and safe, upholding both ethical and regulatory requirements. Question 6. Investigation of the historical development of acupuncture reveals various influential periods and figures. A candidate preparing for the traditional Chinese medicine, TCM, practitioner exams must demonstrate a comprehensive understanding of this history. Which of the following historical perspectives is most crucial for a candidate to grasp to effectively prepare for the examination? Considering the evolution of acupuncture theory and practice as it relates to contemporary clinical application and regulatory standards. Option A. The evolution of acupuncture from its earliest documented forms through the development of key diagnostic and treatment principles to its modern scientific investigation and integration into evidence-based practice. Option B. The biographical details of prominent ancient acupuncturists and their personal contributions to the art of healing, often presented through legendary accounts. Option C. The detailed philosophical debates surrounding the concept of Qi in ancient Chinese texts and their impact on early diagnostic methods. Option D. The socio-political factors influencing the integration of acupuncture into Western medicine and the establishment of regulatory bodies in the 20th century. The correct answer is C. The detailed philosophical debates surrounding the concept of Qi in ancient Chinese texts and their impact on early diagnostic methods. Explanation. This scenario presents a professional challenge due to the need to integrate historical understanding of acupuncture with contemporary practice, while adhering to the specific regulatory framework for traditional Chinese medicine, TCM, practitioner exams. The challenge lies in discerning which historical developments are directly relevant to current examination standards and ethical practice, rather than simply recounting historical facts. Careful judgment is required to identify the most pertinent historical context that informs the principles and techniques assessed in the exam. The correct approach represents best professional practice because it demonstrates an understanding of how the evolution of acupuncture theory and practice has shaped its current form and regulatory oversight. It acknowledges that the examination is designed to assess competency based on established principles and evidence-informed development, not on obscure or outdated historical interpretations. Adherence to the regulatory framework for TCM practitioner exams means focusing on historical aspects that directly influence the knowledge base and practical skills tested, ensuring that the practitioner's understanding is grounded in the lineage and evolution relevant to their licensure. An incorrect approach that focuses solely on the philosophical underpinnings of early acupuncture without connecting them to the development of diagnostic methods or treatment protocols would be professionally unacceptable. This is because the exam likely assesses the application of these principles in a clinical context, not abstract philosophical discourse. Another incorrect approach that emphasizes anecdotal accounts of miraculous cures from ancient texts, without critical evaluation or consideration of scientific validation or modern understanding of efficacy, would also fail to meet professional standards. Such an approach neglects the evolution of evidence-based practice and the ethical imperative to provide treatments supported by contemporary understanding. Furthermore, an approach that prioritizes the political or social history of acupuncture's introduction to different regions over its theoretical and technical development would be a regulatory and ethical failure. The exam is focused on the practice of TCM, and therefore historical context must be directly relevant to the practitioner's knowledge and skills. The professional reasoning process for similar situations involves first identifying the core requirements of the examination and the relevant regulatory body. Then, one must critically evaluate historical information to determine its direct relevance to current practice, theory, and ethical considerations. This involves distinguishing between foundational historical developments that inform current understanding and tangential or purely anecdotal historical accounts. The decision-making process should prioritize historical narratives that explain the evolution of diagnostic methods, treatment strategies, and theoretical frameworks that are still in use or have directly influenced modern TCM practice. Question 7. What factors determine the appropriate application of the 5 elements theory in diagnosing and treating a patient's constitutional imbalances within the framework of traditional Chinese medicine? Option A. The practitioner's application of generalized 5 elements correspondences based on common cultural stereotypes, without individualizing the assessment to the specific patient. Option B. The practitioner's exclusive focus on the patient's reported physical ailments without considering their emotional well-being or the theoretical associations of the 5 elements. Option C. The practitioner's ability to correlate the patient's presented symptoms, emotional states, and physical characteristics with the specific correspondences of wood, fire, earth, metal, and water, while considering their interrelationships and the patient's unique constitution. Option D. The practitioner's reliance on a single dominant elemental characteristic that appears most prominent in the patient's initial complaint, irrespective of other elemental influences. The correct answer is C. The practitioner's ability to correlate the patient's presented symptoms, emotional states, and physical characteristics with the specific correspondences of wood, fire, earth, metal, and water, while considering their interrelationships and the patient's unique constitution. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a TCM practitioner to integrate the abstract principles of the 5 elements theory with the concrete presentation of a patient's symptoms and constitution. The challenge lies in accurately diagnosing the underlying imbalance and formulating an appropriate treatment strategy that aligns with both TCM theory and the patient's individual needs, while adhering to professional standards of practice. Misinterpreting the elemental correspondences or oversimplifying the diagnostic process can lead to ineffective or even harmful treatment. Correct approach analysis. The correct approach emphasizes a holistic assessment that considers the interconnectedness of the 5 elements as they manifest in a patient's physical, emotional, and energetic states. This involves meticulously observing and inquiring about symptoms that correspond to the characteristics of each element, e.g., wood's association with anger and liver function, fire's with joy and heart function, earth's with worry and spleen function, metal's with grief and lung function, and water's with fear and kidney function. The practitioner must then synthesize this information, considering how imbalances in one element can affect others, to arrive at a diagnosis that reflects the patient's unique elemental constitution and current disharmony. This approach represents best professional practice because it is grounded in the core tenets of TCM, ensuring a comprehensive and individualized treatment plan that addresses the root cause of the patient's condition, thereby upholding the ethical obligation to provide competent and effective care. Incorrect approaches analysis. One incorrect approach focuses solely on isolated symptoms without considering their elemental associations or the interrelationships between elements. This leads to a fragmented understanding of the patient's condition, potentially resulting in treatments that only address superficial manifestations rather than the underlying imbalance. This fails to meet the professional standard of holistic assessment and can be ethically problematic due to the potential for ineffective treatment. Another incorrect approach might prioritize a single element's characteristics without acknowledging the dynamic interplay of all 5 elements within a patient. This oversimplification ignores the complex nature of TCM diagnosis and can lead to an unbalanced treatment strategy that exacerbates other elemental imbalances. This represents a failure in diagnostic acumen and a departure from best professional practice. A further incorrect approach could involve applying generalized elemental correspondences without considering the patient's individual constitution, cultural background, or environmental influences. TCM emphasizes individualization, and a rigid application of theory without adaptation to the specific patient is a significant professional and ethical failing, potentially leading to inappropriate treatment. Professional reasoning. Professionals should approach such situations by first grounding themselves in the foundational principles of the 5 elements theory and its application in TCM diagnosis. They must then develop a systematic method for patient assessment, incorporating detailed history-taking, observation, and inquiry specifically tailored to elicit information relevant to elemental correspondences. This involves actively listening to the patient, asking clarifying questions, and observing subtle cues. The practitioner should then engage in critical thinking to synthesize the gathered information, identifying patterns of disharmony across the elemental framework. This process requires a deep understanding of the interelemental relationships, e.g., generating and controlling cycles, and the ability to differentiate between excess and deficiency patterns within each element. Finally, The practitioner must translate this diagnostic understanding into a targeted and individualized treatment plan, constantly evaluating its effectiveness and making adjustments as needed, always prioritizing the patient's well-being and adhering to the ethical principles of TCM practice. Question 8. When evaluating a patient presenting with fatigue, a pale complexion, and a weak pulse, alongside irritability, a red tongue with a thick yellow coat and a forceful pulse, which of the following treatment principles is most appropriate to address the underlying TCM pattern? Option A. Primarily tonify Chi and blood. Option B. Primarily sedate liver Chi stagnation and clear heat from the liver. Option C. Primarily regulate the stomach and spleen. Option D. Primarily tonify Chi and blood, while also sedating liver Chi stagnation and clearing heat from the liver. The correct answer is D. Primarily tonify Chi and blood, while also sedating liver Chi stagnation and clearing heat from the liver. Explanation. This scenario presents a common challenge for traditional Chinese medicine, TCM, practitioners, discerning the most appropriate treatment principle when a patient exhibits complex and seemingly contradictory symptoms. The core difficulty lies in accurately diagnosing the underlying pattern of disharmony and selecting a treatment strategy that addresses the root cause rather than merely the superficial manifestations. Misinterpreting the patient's condition can lead to ineffective treatment, potential harm, and a breach of professional duty of care, which is governed by the specific regulations and ethical guidelines for TCM practitioners within the relevant jurisdiction. The correct approach involves a thorough and systematic assessment of the patient's signs and symptoms, considering their interplay and the underlying TCM diagnostic framework. This allows for the identification of whether the primary imbalance is one of deficiency, requiring tonification, excess, requiring sedation, or a combination that necessitates regulation. Best professional practice dictates that the practitioner must base their treatment choice on this comprehensive diagnosis, adhering to the principles of TCM and the ethical obligations to provide safe and effective care. This aligns with the regulatory expectation that practitioners operate within their scope of practice and apply established diagnostic and therapeutic methodologies. Incorrect approaches arise from superficial assessment, reliance on anecdotal evidence, or a failure to integrate all diagnostic information. For instance, focusing solely on a single prominent symptom without considering its context within the overall pattern can lead to an inappropriate treatment choice. This constitutes a regulatory and ethical failure because it deviates from the established diagnostic protocols and risks providing a treatment that is not indicated, potentially exacerbating the patient's condition or causing new imbalances. Such actions undermine the integrity of the profession and can lead to disciplinary action under the governing regulations. The professional decision-making process for similar situations should involve a structured approach. 1. Comprehensive data gathering. Elicit detailed patient history, observe signs, listen to sounds, inquire about smells, and palpate pulses in the body. 2. Pattern differentiation. Analyze the gathered information to identify the specific TCM pattern of disharmony, e.g., Chi deficiency, blood stasis, liver Chi stagnation. 3. Principle selection. Based on the identified pattern, determine the primary treatment principle, tonify, sedate, or regulate. 4. Method and formula choice. Select appropriate acupuncture points, herbal formulas, or other TCM modalities that align with the chosen principle and pattern. 5. Reevaluation. Continuously monitor the patient's response to treatment and adjust the strategy as needed. Question 9. System analysis indicates a patient present with symptoms that, at first glance, seem to contradict established TCM diagnostic patterns for their chief complaint. The patient reports feeling cold and experiencing fatigue, yet their tongue is red and their pulse is rapid. As a TCM practitioner, how should you approach this diagnostic challenge to ensure effective and philosophically sound treatment? Option A. Prioritize a Western medical diagnosis for the red tongue and rapid pulse, and base treatment solely on that interpretation, disregarding the patient's subjective feelings of cold and fatigue. Option B. Immediately dismiss the patient's reported symptoms of cold and fatigue as inconsistent with the observed red tongue and rapid pulse, assuming a misreporting of symptoms. Option C. Conduct a comprehensive TCM diagnostic assessment, considering the interplay of yin and yang, Chi and blood, and the 5 elements, to identify the underlying pattern of disharmony that explains the seemingly contradictory presentation. Option D. Focus exclusively on treating the red tongue and rapid pulse as the primary issues, without investigating the patient's reported coldness and fatigue or their potential connection to the overall pattern. The correct answer is C. Conduct a comprehensive TCM diagnostic assessment, considering the interplay of yin and yang, qi and blood, and the 5 elements, to identify the underlying pattern of disharmony that explains the seemingly contradictory presentation. Explanation. Scenario analysis. This scenario presents a common challenge for TCM practitioners, where a patient's symptoms appear to contradict established TCM diagnostic principles. The practitioner must navigate the tension between a patient's subjective experience and the objective diagnostic framework of TCM, while also considering potential external factors influencing the presentation. This requires a deep understanding of TCM philosophy to interpret seemingly contradictory signs and symptoms. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a thorough diagnostic process rooted in TCM philosophy. It emphasizes observing the patient's overall presentation, considering the interplay of yin and yang, qi and blood, and the 5 elements, rather than solely focusing on the isolated symptom. This holistic perspective is fundamental to TCM and is implicitly supported by the regulatory framework that mandates practitioners to apply TCM diagnostic methods. By seeking to understand the root imbalance, BEN, and its manifestations, BIO, the practitioner adheres to the core principles of TCM diagnosis and treatment, ensuring a patient-centered and philosophically sound approach. Incorrect approaches analysis. One incorrect approach fails by immediately dismissing the patient's reported symptoms as inconsistent with TCM theory. This demonstrates a rigid adherence to diagnostic patterns, without considering the dynamic and complex nature of the human body as understood in TCM. It neglects the principle that symptoms are manifestations of underlying imbalances, which can present in varied ways. This approach risks misdiagnosis and ineffective treatment, potentially violating ethical obligations to provide competent care. Another incorrect approach errs by prioritizing Western medical interpretations over TCM diagnostic principles. While integration can be beneficial, a TCM practitioner's primary diagnostic lens must be TCM philosophy. Relying solely on Western diagnoses without a TCM framework can lead to a superficial understanding of the patient's condition from a TCM perspective, potentially overlooking crucial TCM-specific patterns and imbalances. This can result in treatments that are not optimally aligned with TCM theory and practice, potentially failing to address the root cause as understood within TCM. A further incorrect approach is to focus exclusively on the most prominent symptom, without considering its relationship to other signs and the patient's overall constitution. TCM emphasizes the interconnectedness of bodily functions and the importance of identifying the primary imbalance. Ignoring this holistic view can lead to treating superficial symptoms without addressing the underlying pathology, which is a fundamental failure in TCM diagnostic reasoning and practice. Professional reasoning. Professionals should approach such scenarios by first acknowledging the patient's report and then systematically applying TCM diagnostic methods. This involves observing the patient's complexion, tongue, pulse, listening to their voice, and inquiring about their lifestyle and emotional state. The practitioner should then synthesize these observations through the lens of yin-yang theory, qi and blood dynamics, and the 5-element correspondences to identify the underlying pattern of disharmony. If a symptom appears contradictory, the practitioner should explore how it might be a manifestation of a more complex imbalance or a secondary effect of a primary condition, always seeking to reconcile the presentation with TCM principles. This iterative process of observation, synthesis, and refinement ensures a comprehensive and philosophically grounded diagnosis. Question 10. The risk matrix shows a moderate likelihood of a patient experiencing a worsening of their condition despite adherence to the prescribed TCM treatment for a common ailment such as chronic fatigue syndrome. The practitioner has observed a decline in the patient's energy levels, an increase in digestive discomfort, and a more pronounced pale tongue presentation, which deviates from the expected positive response. What is the most appropriate next step for the TCM practitioner? Option A. Continue with the original treatment plan, assuming the patient's symptoms are a temporary fluctuation and will resolve with continued adherence. Option B. Introduce a significantly more potent or complex herbal formula and acupuncture technique without a detailed re-diagnosis, aiming to forcefully correct the perceived imbalance. Option C. Conduct a thorough reassessment of the patient's condition, including a detailed review of symptoms, pulse and tongue diagnosis, and re-evaluation of the underlying TCM pattern before modifying the treatment strategy. Option D. Immediately discontinue all TCM treatments and advise the patient to seek Western medical intervention without further TCM assessment. The correct answer is C. Conduct a thorough reassessment of the patient's condition, including a detailed review of symptoms, pulse and tongue diagnosis, and re-evaluation of the underlying TCM pattern before modifying the treatment strategy. Explanation. This scenario presents a professional challenge due to the inherent variability in patient presentation and response to treatment within traditional Chinese medicine, TCM. A practitioner must balance established diagnostic patterns and treatment strategies with the unique physiological and pathological landscape of each individual. The risk matrix highlights potential deviations from expected outcomes, necessitating a nuanced approach that prioritizes patient safety and efficacy while adhering to professional standards and regulatory guidelines. The correct approach represents best professional practice because it emphasizes a thorough, individualized assessment before initiating or modifying treatment. This aligns with the core principles of TCM, which advocate for diagnosis based on pattern differentiation, Bai-Zheng Lunjai, and tailoring treatment accordingly. Specifically, it requires the practitioner to reevaluate the patient's condition, considering new or evolving symptoms, and to adjust the treatment strategy based on this updated diagnosis. This iterative process of assessment, diagnosis, and treatment adjustment is crucial for ensuring the safety and effectiveness of TCM interventions, and it is implicitly supported by the ethical obligations of a TCM practitioner to act in the best interest of the patient. Regulatory frameworks for TCM practitioners typically mandate a high standard of care, which includes diligent patient assessment and appropriate treatment modification. An incorrect approach that involves continuing the original treatment plan without reevaluation, despite the patient's worsening condition, represents a significant regulatory and ethical failure. This demonstrates a disregard for the patient's well-being and a failure to adapt to changing clinical circumstances, potentially leading to harm. Such an approach violates the principle of non-maleficence, do no harm, and could be seen as practicing below the expected standard of care, which is a violation of professional conduct guidelines. Another incorrect approach, that of immediately escalating to a more aggressive or complex treatment without a clear diagnostic rationale for the change, also poses risks. While decisiveness is important, it must be guided by sound diagnostic reasoning. Arbitrarily increasing the intensity of treatment without understanding the underlying cause of the patient's deterioration can lead to adverse effects and mask the true nature of the problem. This could be considered a failure in diagnostic accuracy and a deviation from evidence-based or pattern-based TCM practice, potentially contravening regulatory expectations for competent practice. Finally, an approach that involves discontinuing all TCM treatment without providing alternative recommendations or a clear plan for follow-up is also professionally deficient. While it might stem from a desire to avoid causing further harm, it leaves the patient without care and fails to fulfill the practitioner's responsibility to guide the patient towards recovery or appropriate management. This could be interpreted as abandoning the patient, a serious ethical breach. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize and acknowledge deviations from expected outcomes. 2. Conduct a comprehensive reassessment of the patient's condition, including detailed history-taking, observation, palpation, and pulse and tongue diagnosis. 3. Formulate a revised diagnosis based on the updated assessment. 4. Develop and implement a modified treatment plan that directly addresses the revised diagnosis. 5. Continuously monitor the patient's response to the adjusted treatment. 6. Document all assessments, diagnoses, treatment decisions, and patient responses meticulously. 7. Consult with senior practitioners or specialists if uncertainty persists. Question 11. Cost-benefit analysis shows that investing in advanced training for nuanced pulse diagnosis yields significant long-term benefits in diagnostic accuracy and treatment efficacy for traditional Chinese medicine practitioners. Considering this, Which of the following diagnostic approaches best reflects the comprehensive and integrated nature of TCM pulse diagnosis as mandated by regulatory frameworks for practitioners? Option A. Systematically evaluating all pulse qualities, rate, depth, strength, rhythm, shape, and integrating these findings with other diagnostic information, tongue, history, symptoms, to determine the underlying TCM pattern of disharmony. Option B. Interpreting the pulse solely through the lens of Western medical physiology, attempting to map pulse characteristics directly to specific physiological states without considering TCM pattern differentiation. Option C. Focusing solely on the rate of the pulse, e.g., rapid, slow as the primary determinant of heat or cold patterns, disregarding depth, strength, or rhythm. Option D. Prioritizing the identification of a slippery pulse to immediately diagnose phlegm dampness, irrespective of other pulse qualities or accompanying symptoms. The correct answer is D. Prioritizing the identification of a slippery pulse to immediately diagnose phlegm dampness, irrespective of other pulse qualities or accompanying symptoms. Explanation: scenario analysis. This scenario presents a professional challenge in accurately interpreting complex pulse findings within the framework of traditional Chinese medicine, TCM, practice. The practitioner must balance the theoretical knowledge of pulse types and their associated pathologies with the practical application of diagnosis, ensuring patient safety and efficacy of treatment. The challenge lies in discerning subtle pulse variations and their clinical significance, avoiding oversimplification or misinterpretation that could lead to inappropriate treatment strategies. Adherence to the regulatory framework for TCM practitioners is paramount, ensuring that diagnostic methods are evidence-based within the TCM paradigm and that patient care aligns with established professional standards. Correct approach analysis. The correct approach involves a comprehensive assessment of the pulse, considering its various qualities, rate, depth, strength, rhythm, shape, and integrating these findings with other diagnostic information such as tongue diagnosis, patient history, and presenting symptoms. This holistic interpretation, grounded in the principles of TCM, allows for more accurate diagnosis of the underlying pattern of disharmony. This aligns with the regulatory requirement for TCM practitioners to employ diagnostic methods consistent with the established body of TCM knowledge, and to provide safe and effective care based on a thorough understanding of TCM theory. Incorrect approaches analysis. One incorrect approach is to solely rely on a single pulse characteristic, such as the rate, to determine the diagnosis. This fails to acknowledge the complexity of pulse diagnosis in TCM, where multiple factors contribute to the overall pulse picture. Ethically, this could lead to misdiagnosis and inappropriate treatment, potentially harming the patient. From a regulatory perspective, it demonstrates a lack of adherence to the comprehensive diagnostic principles expected of a licensed TCM practitioner. Another incorrect approach is to dismiss subtle pulse variations as insignificant or within normal limits without further investigation. This overlooks the potential for early signs of disharmony that may not yet manifest as overt symptoms. Such an approach risks delaying diagnosis and treatment, which is contrary to the ethical obligation to provide timely and effective care. It also falls short of the professional standard of meticulous diagnostic inquiry required by regulatory bodies. A further incorrect approach is to apply Western medical diagnostic categories directly to TCM pulse findings without proper TCM pattern differentiation. While Western medicine and TCM can offer complementary insights, TCM pulse diagnosis has its own distinct theoretical framework and interpretation. Attempting to force a direct correlation without understanding the TCM context can lead to inaccurate diagnoses and ineffective treatments, violating the ethical duty to practice within one's scope and the regulatory expectation of competence in TCM diagnostics. Professional reasoning. Professionals should approach pulse diagnosis with a systematic and integrated methodology. This involves 1. Thoroughly palpating the pulse at both positions and both hands, noting all qualitative aspects. 2. Correlating pulse findings with other diagnostic signs and symptoms presented by the patient. 3. Consulting established TCM texts and diagnostic manuals for reference when encountering complex or unusual pulse presentations. 4. Engaging in continuous professional development to refine diagnostic skills and stay abreast of current understanding within the TCM field. 5. Prioritizing patient well-being by ensuring diagnostic accuracy and tailoring treatment plans to the identified TCM pattern. Question 12. The assessment process reveals that a traditional Chinese medicine practitioner has received a shipment of commonly used herbs. To expedite dispensing for a waiting patient, the practitioner visually inspects the herbs, confirms they appear to be the correct species based on familiar characteristics, and proceeds to prepare the prescription without consulting any pharmacopoeia or conducting further quality checks. What is the most appropriate course of action for the practitioner in this situation, considering the regulatory framework for traditional Chinese medicine practitioner exams? Option A. Dispense the herbs immediately to meet patient demand, assuming the supplier's reputation guarantees their quality. Option B. Conduct a thorough verification of the herb's identity and quality, consulting relevant pharmacopoeias and internal quality control protocols before dispensing. Option C. Rely solely on visual identification, as this is a standard practice among experienced TCM practitioners. Option D. Substitute the herbs with a similar-looking but readily available alternative without informing the patient. The correct answer is B. Conduct a thorough verification of the herb's identity and quality, consulting relevant pharmacopoeias and internal quality control protocols before dispensing. Explanation. This scenario presents a professional challenge due to the inherent responsibility of a traditional Chinese medicine (TCM) practitioner to ensure the safety, efficacy, and quality of the herbal products they prescribe. The practitioner must navigate the complexities of sourcing, identification, preparation, and dispensing of herbs, all while adhering to the specific regulatory framework governing TCM practice within the relevant jurisdiction. Careful judgment is required to balance traditional knowledge with modern safety standards and legal obligations. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance. This involves a systematic process of verifying the identity and quality of herbs through established methods, such as macroscopic and microscopic examination, and potentially chemical analysis if indicated. Adherence to good manufacturing practices, GMP, for herbal products, where applicable, and maintaining meticulous records of sourcing and dispensing are crucial. This approach aligns with the ethical duty of care and the legal requirements to provide safe and effective treatment, ensuring that the prescribed herbs meet defined quality standards and are free from adulterants or contaminants. An incorrect approach that involves relying solely on visual identification without further verification is professionally unacceptable. This poses a significant risk of misidentification, leading to the use of incorrect or potentially toxic herbs, thereby violating the duty of care and potentially causing harm to the patient. Ethically, it demonstrates a lack of diligence. Legally, it could be considered negligence and a failure to meet professional standards. Another incorrect approach, such as dispensing herbs without confirming their origin or batch information, is also professionally unacceptable. This failure to maintain traceability undermines quality control and makes it impossible to investigate any adverse events or product recalls. It represents a breach of professional responsibility and regulatory requirements for record keeping and product accountability. A third incorrect approach, which involves substituting herbs without consulting the patient or documenting the change, is ethically and professionally unsound. This undermines patient autonomy and informed consent. It also compromises the integrity of the treatment plan and the practitioner's ability to monitor efficacy and safety. Regulatory frameworks often mandate clear communication and documentation of any deviations from the prescribed treatment. The professional decision-making process for similar situations should involve a multifaceted approach. 1. Prioritize patient safety above all else. 2. Thoroughly understand and adhere to all relevant TCM regulations, laws, and guidelines of the specific jurisdiction. 3. Implement robust quality control measures for all herbal products, including verification of identity, purity, and potency. 4. Maintain accurate and comprehensive records of all herbal products used, including sourcing, batch numbers, and dispensing details. 5. Communicate openly and honestly with patients regarding their treatment, including any substitutions or changes to prescribed herbs. 6. Engage in continuous professional development to stay abreast of best practices in herbal medicine and regulatory updates. Question 13. System analysis indicates a patient presents with a pale tongue with a thin, white coat, a weak and deep pulse, fatigue, poor appetite, and loose stools. The practitioner is considering several potential patterns of disharmony. Which of the following diagnostic approaches best aligns with the principles of traditional Chinese medicine for identifying the most likely pattern? Option A. Focusing on the Western medical interpretation of fatigue and loose stools to guide the TCM diagnosis, bypassing traditional TCM diagnostic methods. Option B. Systematically evaluating all presented signs and symptoms, including tongue appearance, pulse quality, and the nature of fatigue, appetite, and bowel movements, to identify the most fitting TCM pattern based on established diagnostic criteria. Option C. Directly correlating the symptoms of fatigue and poor appetite with a diagnosis of liver Chi stagnation, assuming these are the primary manifestations. Option D. Prioritizing the pale tongue and loose stools to immediately diagnose spleen yang deficiency, without further consideration of other symptoms or diagnostic signs. Correct answer is D. Prioritizing the pale tongue and loose stools to immediately diagnose spleen yang deficiency without further consideration of other symptoms or diagnostic signs. Explanation. Scenario analysis. This scenario presents a common challenge in traditional Chinese medicine, TCM, practice, differentiating between similar patterns of disharmony based on subtle clinical presentations. Practitioner must synthesize information from various diagnostic methods, including pulse and tongue diagnosis, patient history, and symptomology, to arrive at an accurate TCM diagnosis. Misdiagnosis can lead to ineffective treatment, patient dissatisfaction, and potentially exacerbate the underlying condition, impacting patient safety and the practitioner's professional reputation. Adherence to the established diagnostic framework for TCM is paramount. Correct approach analysis. The correct approach involves a systematic and comprehensive evaluation of the patient's signs and symptoms, correlating them with the established diagnostic criteria for common TCM patterns of disharmony. This requires a deep understanding of TCM theory, including the interrelationships of Zhang-Fu organs, Qi, blood, yin, and yang, and how these manifest as specific disharmonies. The practitioner must prioritize the most prominent and consistent signs to identify the root pattern and its manifestations. This aligns with the ethical and professional standards of TCM practice, emphasizing accurate diagnosis as the foundation for effective treatment. Regulatory frameworks for TCM practitioners typically mandate that diagnosis be based on established TCM principles and diagnostic methods. Incorrect approaches analysis. One incorrect approach is to focus solely on a single prominent symptom without considering the broader clinical picture. This can lead to a superficial diagnosis, overlooking the underlying root cause of the disharmony. For example, treating only insomnia without investigating potential liver Chi stagnation or spleen Chi deficiency would be a failure to adhere to comprehensive TCM diagnostic principles. Another incorrect approach is to rely heavily on Western medical diagnoses to inform TCM pattern differentiation. While Western diagnoses can provide context, TCM patterns are distinct and require diagnosis through TCM methods. Applying Western diagnostic labels directly to TCM patterns without proper TCM correlation is a deviation from the regulatory framework governing TCM practice. A third incorrect approach is to make a diagnosis based on limited diagnostic information, such as only observing the tongue without palpating the pulse or taking a thorough patient history. This incomplete assessment risks misinterpretation of signs and symptoms, leading to an inaccurate TCM diagnosis and potentially inappropriate treatment. Regulatory guidelines for TCM practitioners emphasize the importance of utilizing multiple diagnostic methods for a robust assessment. Professional reasoning. Professionals should approach patient assessment by first gathering all available information through the 4 diagnostic methods: observation, listening/smelling, inquiry, and palpation. They should then analyze these findings in the context of TCM theory, identifying the most consistent and significant signs that point to a specific pattern of disharmony. This involves a process of elimination and correlation, prioritizing the root pattern over superficial manifestations. When faced with ambiguity, seeking consultation with a more experienced practitioner or referring to authoritative TCM texts is a sign of professional integrity and adherence to best practices. Decision-making should always be guided by the principle of first, do no harm, and the commitment to providing evidence-based TCM care within the established regulatory framework. Question 14. Strategic planning requires a TCM practitioner to consider the long-term implications of a patient's lifestyle choices on their fundamental vital substances. A patient presents with chronic fatigue, poor memory, and early signs of aging, which the practitioner suspects may be related to a depletion of Jing. The practitioner must decide on the most appropriate course of action. Which of the following approaches best aligns with the ethical and regulatory framework for TCM practitioners in managing Jing-related concerns? Option A. Advise the patient that Jing depletion is an irreversible condition and focus solely on managing the symptoms without attempting to address the underlying cause. Option B. Conduct a thorough TCM diagnosis to assess the extent of Jing depletion and its contributing factors. Then collaboratively develop a treatment plan that includes lifestyle modifications, dietary advice, and appropriate TCM therapies, ensuring the patient understands the rationale behind each recommendation. Option C. Immediately prescribe potent tonifying herbs and recommend intensive Qi Gong practices to rapidly replenish the patient's Jing, aiming for quick visible results. Option D. Focus on immediate symptomatic relief of fatigue and memory issues with herbs and acupuncture, while deferring discussion about Jing depletion to a later stage when the patient is more receptive. The correct answer is D. Focus on immediate symptomatic relief of fatigue and memory issues with herbs and acupuncture, while deferring discussion about Jing depletion to a later stage when the patient is more receptive. Explanation. This scenario presents a professional challenge due to the inherent complexity of diagnosing and treating conditions related to Jing, which is a fundamental yet often subtle concept in traditional Chinese medicine, TCM. The practitioner must balance the patient's immediate concerns with the long-term implications of Jing depletion, requiring careful judgment and a deep understanding of TCM principles within the established regulatory framework for TCM practitioners. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's overall health and lifestyle, directly addressing the root causes of potential Jing depletion. This aligns with the ethical obligation to provide holistic care and to educate patients about the factors influencing their health, including the role of Jing. Adhering to the regulatory framework means ensuring that all diagnostic and treatment recommendations are evidence-based within the scope of TCM practice and are communicated transparently to the patient, allowing for informed consent and collaborative decision-making. This approach respects the patient's autonomy and promotes long-term well-being by empowering them to make lifestyle changes that support Jing preservation. An incorrect approach that focuses solely on immediate symptomatic relief without investigating the underlying Jing deficiency would be professionally unacceptable. This failure stems from a lack of adherence to the holistic principles of TCM, potentially leading to a superficial treatment that does not address the root cause of the patient's condition. Ethically, this could be seen as neglecting the practitioner's duty to provide thorough and effective care. Another incorrect approach, such as recommending aggressive or unproven treatments to replenish Jing without adequate diagnostic justification or patient consent, would violate regulatory guidelines concerning safe and ethical practice. This could involve overstepping the bounds of professional competence or engaging in practices that are not supported by the established TCM framework, potentially harming the patient and undermining professional credibility. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the patient's presenting complaints and medical history, considering how they might relate to Jing. Second, conduct a comprehensive TCM diagnosis, including pulse and tongue examination, to identify patterns of disharmony, particularly those affecting Jing. Third, engage in open and honest communication with the patient, explaining the TCM understanding of Jing and its relevance to their condition in clear, understandable terms. Fourth, collaboratively develop a treatment plan that addresses both immediate symptoms and the underlying Jing deficiency, incorporating lifestyle and dietary recommendations. Finally, ensure all proposed treatments are within the scope of practice, ethically sound, and fully consented to by the patient. Question 15. The control framework reveals that a licensed traditional Chinese medicine practitioner is preparing to treat a patient presenting with chronic lower back pain. The patient has a history of hypertension and is currently taking anticoagulant medication. The practitioner has identified several potential acupuncture points for treatment. Considering the patient's medical history and the regulatory requirements for safe practice. Which of the following approaches to needle insertion, manipulation, and retention best aligns with professional standards and ethical obligations? Option A. Administer electroacupuncture at the maximum intensity to ensure rapid pain relief, as this is a common and effective method for chronic pain, and document the treatment only after the patient has left the clinic. Option B. Prioritize deeper needle insertions at the identified points to achieve a stronger therapeutic effect, as chronic pain often requires more vigorous stimulation, and inform the patient about potential bruising due to anticoagulants after the needles are retained. Option C. Proceed with standard needle insertion depths and manipulation techniques at the identified points, assuming the patient's history does not significantly alter the general approach. Option D. Conduct a thorough pre-treatment assessment to evaluate the patient's current health status, specifically inquiring about any recent changes in their condition, and adjust needle insertion depth and manipulation techniques based on their history of hypertension and anticoagulant use, prioritizing shallower insertions and gentler manipulation where indicated. The correct answer is C. Proceed with standard needle insertion depths and manipulation techniques at the identified points, assuming the patient's history does not significantly alter the general approach. Explanation: this scenario presents a professional challenge due to the inherent risks associated with needle insertion and manipulation in traditional Chinese medicine, TCM, practice. The practitioner must balance the therapeutic goals of the treatment with the paramount duty of patient safety, adhering strictly to established protocols and ethical guidelines. The control framework, encompassing regulatory requirements and professional standards, mandates a meticulous approach to needle techniques to prevent adverse events and ensure effective treatment. The correct approach represents best professional practice because it prioritizes patient safety through a systematic and informed process. This involves a thorough pre-treatment assessment to identify contraindications and patient-specific factors, precise needle insertion technique, guided by anatomical knowledge and established insertion depths, and appropriate manipulation and retention strategies tailored to the patient's condition and response. This aligns with the regulatory framework's emphasis on competent practice, risk management, and the ethical obligation to do no harm. Adherence to these principles ensures that the treatment is both effective and safe, minimizing the likelihood of complications such as pneumothorax, nerve damage, or infection. An incorrect approach, such as proceeding with treatment without a comprehensive patient assessment, demonstrates a failure to comply with fundamental regulatory requirements for patient care and risk mitigation. This oversight could lead to inappropriate treatment selection, potentially exacerbating existing conditions or causing new harm, thereby violating ethical principles and professional standards. Another incorrect approach, involving aggressive or inappropriate needle manipulation without monitoring the patient's response, constitutes a direct breach of safe practice guidelines. This could result in iatrogenic injury, such as excessive bleeding, fainting, or nerve irritation, and reflects a disregard for the practitioner's duty of care. Furthermore, neglecting to document the procedure and patient response, a common failing in incorrect approaches, hinders accountability and continuity of care, and is often a specific requirement within regulatory frameworks for professional practice. Professional decision-making in such situations should be guided by a framework that begins with a comprehensive understanding of the patient's health status, including any contraindications or sensitivities. This is followed by a clear articulation of the treatment objectives and the selection of appropriate needle techniques based on evidence-based practice and established TCM principles. Throughout the procedure, continuous patient monitoring for any adverse reactions is crucial. Finally, meticulous documentation of the entire process, including needle insertion depth, manipulation techniques, retention time, and patient response, ensures accountability and facilitates future treatment planning. This systematic approach, grounded in regulatory compliance and ethical responsibility, forms the bedrock of safe and effective TCM practice. Question 16. Cost-benefit analysis shows that while certain advanced acupuncture techniques may offer perceived patient satisfaction, a practitioner's primary responsibility is to ensure the efficacy and safety of treatment based on a thorough diagnostic assessment. A patient presents with chronic lower back pain and expresses a strong desire for a specific, less common acupuncture technique they read about online, which is not typically the first-line approach for their diagnosed condition. The practitioner has identified a standard, well-researched acupuncture protocol that is highly effective for this type of pain. What is the most professionally responsible course of action? Option A. Agree to perform the patient-requested technique without further diagnostic evaluation, assuming the patient's research indicates it is a viable option, and then proceed with the standard protocol if the requested technique proves ineffective. Option B. Firmly refuse to consider the patient-requested technique, stating that only the practitioner's chosen protocol is effective, and dismiss the patient's online research as unreliable. Option C. Immediately proceed with the patient-requested advanced acupuncture technique, prioritizing patient satisfaction and autonomy over the practitioner's initial diagnostic assessment and standard treatment protocols. Option D. Conduct a thorough TCM diagnosis, explain the rationale for the standard, evidence-based treatment protocol, and discuss how it addresses the patient's pain, while also exploring the patient's interest in the alternative technique, assessing its safety and suitability, and offering it as a potential adjunct or alternative if clinically appropriate and safe. The correct answer is D. Conduct a thorough TCM diagnosis, explain the rationale for the standard, evidence-based treatment protocol, and discuss how it addresses the patient's pain, while also exploring the patient's interest in the alternative technique, assessing its safety and suitability, and offering it as a potential adjunct or alternative if clinically appropriate and safe. Explanation. This scenario presents a professional challenge because it requires a traditional Chinese medicine, TCM, practitioner to balance patient-centered care with adherence to established diagnostic and treatment protocols, particularly when a patient expresses a preference that deviates from the practitioner's initial assessment. The practitioner must exercise sound clinical judgment, ensuring that any deviation from standard practice is safe, ethically justifiable, and ultimately beneficial to the patient, while also respecting patient autonomy. Correct approach represents best professional practice because it prioritizes patient safety and well-being through a thorough, evidence-informed diagnostic process before considering alternative techniques. It involves open communication with the patient, explaining the rationale behind the recommended treatment, and collaboratively exploring options that align with both TCM principles and the patient's expressed desires, provided these options are safe and appropriate. This approach upholds the ethical duty of beneficence and non-maleficence, ensuring that treatment decisions are based on a comprehensive understanding of the patient's condition and the potential efficacy and risks of various acupuncture techniques. It also respects patient autonomy by involving them in the decision-making process. An incorrect approach that involves immediately adopting a patient-requested acupuncture technique without a proper diagnostic assessment and consideration of its suitability for the patient's condition would be a significant regulatory and ethical failure. This bypasses the fundamental TCM diagnostic process, which is a cornerstone of safe and effective practice. It could lead to inappropriate treatment, delayed recovery, or even harm to the patient, violating the principles of non-maleficence. Furthermore, it demonstrates a lack of professional diligence and adherence to established practice standards, potentially contravening guidelines set forth by TCM regulatory bodies that mandate thorough patient evaluation. Another incorrect approach, such as dismissing the patient's preference outright without exploring its underlying reasons, or offering alternative evidence-based techniques that might address the patient's concerns, would also be professionally unacceptable. This could be seen as a failure to respect patient autonomy and a lack of empathetic communication, potentially damaging the therapeutic relationship and leading to patient dissatisfaction. While maintaining professional integrity is crucial, a rigid refusal to engage with patient preferences can be detrimental to collaborative care. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a comprehensive TCM diagnosis, including pulse and tongue examination and detailed history taking. 2. Formulate a treatment plan based on the diagnosis and established TCM principles. 3. Engage in open and honest communication with the patient, explaining the diagnosis and the rationale for the proposed treatment plan. 4. Actively listen to the patient's concerns and preferences, exploring the reasons behind them. 5. If the patient's preference deviates from the initial plan, critically evaluate its safety, efficacy, and appropriateness for the diagnosed condition. 6. If the preferred technique is deemed safe and potentially beneficial, discuss its integration or modification of the original plan. 7. If the preferred technique is deemed unsafe or inappropriate, clearly explain the reasons to the patient, and offer alternative evidence-based options that address their concerns. 8. Document all assessments, discussions, and treatment decisions thoroughly. Question 17. Operational review demonstrates that a long-term patient with a chronic condition, who frequently seeks treatment for symptom exacerbations, expresses significant reluctance and skepticism when preventative lifestyle and dietary recommendations, central to TCM's approach to managing such conditions, are discussed. The practitioner is concerned that, without adopting these preventative measures, the patient's condition will continue to fluctuate, impacting their quality of life. What is the most appropriate course of action for the TCM practitioner in this situation? Option A. Gently reiterate the long-term benefits of preventative TCM practices, offering to collaboratively develop a gradual plan for incorporating small, manageable changes that align with the patient's current lifestyle and comfort level, while continuing to address their acute symptoms. Option B. Advise the patient that their condition is likely to worsen significantly due to their unwillingness to engage in preventative care, and suggest they seek treatment elsewhere if they are not prepared to follow all recommendations. Option C. Focus exclusively on treating the patient's acute symptoms during each visit, as their current priority appears to be immediate relief, and postpone any discussion of preventative measures until they express a clearer interest. Option D. Strongly emphasize the necessity of immediate and comprehensive adoption of all recommended preventative lifestyle and dietary changes, explaining that their chronic condition will not improve without such drastic measures. The correct answer is A. Gently reiterate the long-term benefits of preventative TCM practices, offering to collaboratively develop a gradual plan for incorporating small, manageable changes that align with the patient's current lifestyle and comfort level, while continuing to address their acute symptoms. Explanation. Scenario analysis. This scenario presents a professional challenge for a traditional Chinese medicine, TCM, practitioner where a patient, despite experiencing significant discomfort and seeking treatment for a chronic condition, is resistant to preventative advice. The practitioner must balance the immediate need to alleviate the patient's symptoms with the long-term benefits of TCM's preventative principles. This requires careful communication, ethical consideration of patient autonomy, and adherence to professional standards that emphasize holistic well-being, which inherently includes prevention. The challenge lies in effectively conveying the importance of preventative measures without alienating the patient or overstepping professional boundaries. Correct approach analysis. The correct approach prioritizes patient education and empowerment within the framework of TCM's preventative philosophy. It involves clearly explaining how lifestyle and dietary adjustments, core tenets of TCM prevention, can address the root causes of the patient's chronic condition and improve their overall health trajectory. This aligns with the ethical obligation of a TCM practitioner to provide comprehensive care, which extends beyond symptom management to promoting long-term wellness. By offering tailored, actionable advice and respecting the patient's pace, the practitioner upholds professional integrity and fosters a collaborative therapeutic relationship consistent with the spirit of TCM's emphasis on harmony and balance. Incorrect approaches analysis. One incorrect approach involves solely focusing on symptom relief and neglecting to address the underlying preventative aspects of the condition. This fails to uphold the holistic principles of TCM, which strongly emphasizes prevention as a cornerstone of health maintenance. Ethically, it can be seen as providing incomplete care, potentially leading to recurring or worsening symptoms, and failing to empower the patient with knowledge for self-management. Another incorrect approach is to insist on immediate and drastic lifestyle changes, disregarding the patient's current resistance and comfort level. This can be perceived as paternalistic and may lead to patient noncompliance, damaging the therapeutic alliance. It disregards the ethical principle of respecting patient autonomy and can be counterproductive to achieving long-term health goals. A third incorrect approach might be to dismiss the patient's concerns about preventative measures as unimportant or to imply that their condition is solely due to their lack of adherence. This is unprofessional, lacks empathy, and fails to acknowledge the complexities of chronic illness and patient engagement. It violates the ethical duty to treat patients with respect and dignity. Professional reasoning. When faced with a patient resistant to preventative advice, a TCM practitioner should employ a patient-centered approach. This involves 1. Active listening, understanding the patient's concerns and barriers to adopting preventative measures. 2. Clear communication, explaining the TCM rationale for prevention in simple, understandable terms, linking it directly to their current symptoms and long-term health. 3. Gradual implementation, suggesting small, manageable changes rather than overwhelming the patient. 4. Collaborative goal setting, working with the patient to identify achievable preventative goals. 5. Reinforcement and support, regularly checking in on progress and offering encouragement. This process ensures that care is both effective and ethically sound, respecting the patient agency while guiding them towards optimal health outcomes as envisioned by TCM principles. Question 18. The risk matrix shows a high probability of patient dissatisfaction and potential for treatment ineffectiveness if a TCM practitioner fails to adequately address the fundamental principle of balance and harmony in their diagnostic and treatment approach. Considering a patient presenting with symptoms of both heat e.g., fever, thirst, and cold e.g., chills, pale complexion, which of the following diagnostic and treatment strategies best upholds the importance of balance and harmony in TCM? Option A. Prioritize identifying the underlying pattern of disharmony, such as yin deficiency with empty heat or yang deficiency with cold, and tailor the treatment to tonify deficiencies and clear excesses accordingly, aiming to restore equilibrium. Option B. Focus solely on treating the most prominent symptom, such as reducing the fever, without investigating the co-occurrence of chills, as this is the most distressing symptom for the patient. Option C. Rely primarily on Western medical diagnostic results to guide the TCM treatment, assuming that the Western diagnosis will inherently reveal the TCM pattern of imbalance. Option D. Apply a standard acupuncture protocol for fever and a separate protocol for chills, without attempting to understand how these seemingly contradictory symptoms relate to a single underlying imbalance. Correct answer is A. Prioritize identifying the underlying pattern of disharmony, such as yin deficiency with empty heat or yang deficiency with cold, and tailor the treatment to tonify deficiencies and clear excesses accordingly, aiming to restore equilibrium. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the TCM practitioner to interpret and apply the core principle of balance and harmony, yin and yang, qi and blood, in a complex patient presentation where symptoms appear contradictory or imbalanced. The challenge lies in discerning the root cause of disharmony from a multitude of presenting signs and symptoms, which demands a deep understanding of TCM theory and its practical application, rather than a superficial symptom-matching approach. The practitioner must navigate the potential for misdiagnosis or ineffective treatment if the underlying imbalance is not accurately identified. Correct approach analysis. The correct approach emphasizes a holistic assessment that prioritizes identifying the fundamental pattern of disharmony. This aligns with the foundational principles of TCM, which view the body as an interconnected system where imbalance in one area affects others. By seeking to understand the root cause of the disharmony, whether it's an excess or deficiency of yin or yang, or a stagnation or deficiency of qi and blood, the practitioner can formulate a treatment strategy that addresses the underlying issue, thereby restoring overall balance and harmony. This approach is ethically sound as it aims for the most effective and comprehensive patient care, adhering to the practitioner's duty to promote health and well-being. Incorrect approach is analysis. One incorrect approach focuses solely on alleviating the most prominent or distressing symptom without investigating its underlying cause. This fails to address the root of the imbalance, potentially leading to temporary relief, but not a resolution of the disharmony. Ethically, this could be considered a failure to provide adequate care if a more fundamental issue is ignored. Another incorrect approach involves applying a treatment protocol based on a superficial understanding of a single symptom or a limited set of symptoms, without considering the interplay of other signs and their relationship to the overall energetic state of the patient. This risks exacerbating other imbalances or creating new ones, deviating from the principle of restoring holistic harmony. A third incorrect approach might involve relying on external diagnostic tools or Western medical diagnoses as the sole basis for TCM treatment, neglecting the unique diagnostic framework and principles of TCM. While integration can be beneficial, it should not supersede the core TCM understanding of balance and harmony as the primary diagnostic and therapeutic guide. This approach fails to leverage the strengths of TCM and may lead to treatments that are incongruent with the patient's TCM diagnosis. Professional reasoning. Professionals should employ a systematic diagnostic process that begins with a thorough intake, including detailed questioning about symptoms, lifestyle, emotional state, and medical history. This is followed by observation, tongue, complexion, listening and smelling, and palpation, pulse diagnosis. The practitioner then synthesizes this information to identify the underlying pattern of disharmony according to TCM theory. Treatment strategies, including acupuncture, herbal medicine, and lifestyle recommendations, are then chosen to directly address this identified pattern, aiming to restore the body's natural balance and harmony. This iterative process of diagnosis and treatment adjustment ensures that care remains focused on the patient's fundamental energetic state. Question 19. The assessment process reveals a patient presenting with chronic fatigue, insomnia, and a persistent feeling of unease which they attribute to a recent significant life disappointment. As a traditional Chinese medicine (TCM) practitioner, how should you approach the diagnosis and treatment of this patient, considering the interrelationship of body, mind, and spirit? Option A. Recommend the patient seek immediate psychological counseling for their emotional distress, as this is outside the scope of TCM practice. Option B. Treat the physical symptoms of fatigue and insomnia with standard TCM protocols, and advise the patient to manage their emotional state through personal coping mechanisms without direct intervention from the practitioner. Option C. Primarily address the physical symptoms of fatigue and insomnia with acupuncture and herbal medicine, assuming the emotional distress will resolve on its own once the physical discomfort is alleviated. Option D. Focus on identifying and treating the underlying TCM patterns that manifest as fatigue and insomnia, while also exploring the patient's emotional response to the life disappointment and its impact on their Shen, spirit/mind. The correct answer is D. Focus on identifying and treating the underlying TCM patterns that manifest as fatigue and insomnia, while also exploring the patient's emotional response to the life disappointment and its impact on their Shen, spirit/mind. Explanation. The assessment process reveals a patient presenting with symptoms that manifest physically but are deeply rooted in emotional distress, highlighting the interconnectedness of body, mind, and spirit in traditional Chinese medicine, TCM. This scenario is professionally challenging because it requires the practitioner to move beyond a purely symptomatic treatment approach and consider the holistic well-being of the patient. Effective TCM practice necessitates understanding how emotional imbalances, Shen, can disrupt the flow of Qi and blood, leading to physical manifestations, and how physical ailments can, in turn, impact mental and spiritual states. Careful judgment is required to accurately diagnose the root cause, which may not be immediately apparent in the physical symptoms. The correct approach represents best professional practice because it aligns with the core tenets of TCM, emphasizing the diagnosis and treatment of the whole person. By considering the patient's emotional state, lifestyle, and spiritual outlook alongside their physical complaints, a practitioner can develop a comprehensive treatment plan that addresses the underlying disharmony. This holistic perspective is not only ethically sound, but also leads to more effective and sustainable patient outcomes, as it seeks to restore balance across all levels of being. This aligns with the ethical obligation to provide patient-centered care and to practice within the scope of TCM principles, which inherently recognize the body-mind-spirit continuum. An incorrect approach that focuses solely on the physical symptoms without investigating the emotional or spiritual contributors would be professionally unacceptable. This would represent a failure to adhere to the fundamental principles of TCM, potentially leading to incomplete treatment and a lack of understanding of the patient's overall condition. Ethically, it could be seen as a failure to provide comprehensive care and to fully assess the patient's needs. Another incorrect approach might involve the practitioner attempting to provide psychological counseling beyond their scope of practice as a TCM practitioner. While acknowledging the mental and spiritual aspects is crucial, TCM practitioners are trained in specific diagnostic and therapeutic modalities related to TCM. Overstepping these boundaries could lead to ineffective or even harmful interventions and would be a regulatory and ethical failure. A third incorrect approach could be to dismiss the patient's emotional or spiritual concerns as irrelevant to their physical ailments. This would demonstrate a lack of understanding of the TCM model and a failure to engage in empathetic and holistic patient care. It would neglect a significant aspect of the patient's experience and hinder the practitioner's ability to identify the root cause of the disharmony. The professional decision-making process for similar situations should involve a systematic assessment that integrates the patient's physical presentation with their emotional state, mental outlook, and spiritual well-being. This requires active listening, open-ended questioning, and a deep understanding of TCM diagnostic principles that link these different aspects of human experience. The practitioner must then synthesize this information to formulate a diagnosis and treatment plan that addresses the interconnectedness of body, mind, and spirit, always operating within their defined scope of practice as a TCM practitioner. Question 20. Benchmark analysis indicates that a traditional Chinese medicine practitioner is assessing a patient presenting with fatigue, a pale complexion, and a weak pulse. The practitioner has conducted a thorough inquiry about the patient's lifestyle and diet. Which of the following approaches best represents the next critical step in a comprehensive TCM diagnosis, ensuring adherence to regulatory requirements for practitioner competency? Option A. Proceed with a detailed inspection of the patient's tongue and a thorough palpation of the pulse to gather objective diagnostic information. Option B. Rely solely on the information gathered from the inquiry, assuming the patient's self-reporting is sufficient for diagnosis. Option C. Conduct a brief auscultation of the patient's breathing and voice, then conclude the diagnostic process based on this limited information. Option D. Focus exclusively on further detailed inquiry regarding the patient's emotional state, as fatigue can often be linked to psychological factors. The correct answer is A. Proceed with a detailed inspection of the patient's tongue and a thorough palpation of the pulse to gather objective diagnostic information. Explanation. Scenario analysis. A practitioner is presented with a patient exhibiting subtle symptoms that could be indicative of multiple underlying TCM patterns. The challenge lies in accurately differentiating these patterns to formulate an effective treatment plan, as misdiagnosis can lead to ineffective or even harmful interventions. The practitioner must rely on a comprehensive application of the 4 diagnostic methods, ensuring each is utilized to its fullest potential to gather sufficient and accurate information. Correct approach analysis. The correct approach involves a systematic and integrated application of all 4 diagnostic methods: inspection, auscultation and olfaction, inquiry, and palpation. This aligns with the fundamental principles of TCM diagnosis as outlined in the regulatory framework for TCM practitioners. Each method provides unique insights. Inspection reveals the patient's general appearance, complexion, tongue, and secretions. Auscultation and olfaction capture sounds of breathing, voice, and any unusual body odors. Inquiry elicits the patient's subjective experience of symptoms, history, and lifestyle. Palpation assesses the pulse, abdomen, and specific body areas for tenderness or temperature variations. By synthesizing the information from all 4 methods, the practitioner can form a holistic and accurate diagnosis, which is a core ethical and professional requirement for safe and effective practice. Incorrect approach is analysis. An approach that overemphasizes one diagnostic method while neglecting others is professionally unacceptable. For instance, relying solely on inquiry without thorough inspection and palpation would miss crucial objective signs like tongue changes or pulse quality, leading to an incomplete and potentially erroneous diagnosis. This failure to conduct a comprehensive assessment violates the professional standard of care and the regulatory requirement for thorough diagnostic procedures. Another incorrect approach would be to prioritize subjective patient reports over objective findings from inspection, auscultation and olfaction, or palpation. While patient history is vital, it must be corroborated and contextualized by objective data. Ignoring objective signs because they contradict the patient's narrative would be a significant diagnostic error, potentially leading to incorrect treatment and a breach of professional duty. Furthermore, a superficial application of any method, such as a cursory glance at the tongue or a brief pulse check, would be insufficient. The regulatory framework mandates a detailed and skilled application of each diagnostic method. A lack of diligence in any of the 4 methods constitutes a failure to meet the expected professional competence and can result in diagnostic inaccuracies, contravening ethical obligations to provide competent care. Professional reasoning. Professionals should employ a structured decision-making framework that begins with understanding the patient's chief complaint. This is followed by a systematic application of the 4 diagnostic methods, meticulously gathering data from each. The practitioner then critically analyzes and synthesizes this information, looking for patterns and correlations. If discrepancies arise or the diagnosis remains unclear, further investigation or consultation may be necessary. This iterative process ensures that the diagnosis is based on comprehensive evidence, leading to the most appropriate and effective treatment plan, thereby upholding professional standards and patient safety.